Here you will notice that we have cones. These cones are used for anesthetizing patients if we need them. You know, when we're getting ready to intubate, if we weren't quick enough or whatever, we use these a lot, okay? Stick the nose in there, good to go, okay? Like that?
Yeah.
This is our crash cart or our crash box. This has all of our emergency drugs, well, not the emergency drugs, but the emergency access supplies in it. Catheters, the ambu bag, all that kind of stuff. This is your responsibility as surgery techs to monitor and evaluate this box weekly. So every week this needs to be gone through, make sure everything is there, make sure everything is not expired, and then you take a big fat piece of tape and you write box checked, date, and your initials and put it over the top of it. Okay? And I want it kind of wrapping over like that, okay, so that we know no one's been in it. Okay?
Once a week we have to do that?
Once a week. Yep.
Good job, Angie.
This is our cat box, or our induction box, if you will. We will use this for crazy cats that are unhandleable at times, feral cats, things like that. Put the kitty, yes. Put the kitty in the box, okay, or small dogs fit in here too, okay. You attach the anesthesia machine right here. They breathe in the gas, they go night-night, then we can go ahead and get them intubated from there. All right?
Medical term.
Night-night.
No.
Medical term.
It's in the book.
Down here, we have our supplies. We have hydrogen peroxide, all right? We also have a little bottle of hydrogen peroxide wandering around here somewhere that we use for surgery and everything. Biggest thing with this is you do not take a gauze square, pour it on there, wipe on the patient, and then pour it on there again. This should not come in contact with anything that has come in contact with the patient, all right? Please respect that factor. It does have to be kept in a dark container because it is light sensitive. It's not just for looks because brown is so attractive. Okay?
Yeah.
All right. Alcohol. We use alcohol for prep. We use alcohol for drawing blood, lots of things. So there is your alcohol. We also have a couple little bottles, which I don't know when we got those, but that's okay. Branson, this is our ultrasonic cleaner solution. I will show you how to use the machine in a little bit, but this is the solution that you use for that. Directions are right on here on how to dilute it and how to do it. This is something that will be changed every week as well. So the morning of surgery, well, you guys are at night. So afternoon of surgery, you come in, you change your fluids, get them all ready for that day. This is your speed clean. This is used for cleaning your autoclave. Okay. This will need to be done once a month. Again, directions, word for word, are very simple right here. I will show you real quick how to do that as well. But it is your responsibility to care for the machines as well with being surgery. Okay. Ultrasonic gel, which we use for hooking up our EKG leads, also for performing ultrasounds if we do any ultrasounds. Second shelf. We have some surgical scrub. This is the same, well, this is betadine, but we really don't use the betadine. It's here if we need it. We use it more for large animal, okay? But we do have lots of dermachlor, which is the same thing as your chlorhexidine. We use scrub versus the solution for all of our surgical preps. The scrub has the sudsing effect, brings all the bacteria and everything to the surface. So you will dilute this in your scrub containers 60 to 40 with your water, okay? And you do want to use your distilled water for mixing this because we are cleaning a patient. We don't want to use dirty city water, grossness, okay?
What's that called again?
What's that?
What's it?
This is your chlorhexidine solution.
Oh, I
Also, it's also called Dermachlor. Dermachlor is
yeah.
more of the brand
60
name. 60,
for-
40.
Is it 60?
60%
Yeah,
this,
that's
40% water. Okay? So it makes it nice and sudsy.
and it's distilled.
Distilled water. Yep. Basically everything in here is distilled water. Okay? Instrument lubricant. This is something else that you'll be changing weekly. Okay, these should also be changed every afternoon when you guys come in for surgery. Okay? Instrument lube is used for lubricating and protecting our instruments. So after the instruments are cleaned, they go into the milk bath, which is called the milk bath, to allow for everything to stay nice and loose and also to protect it against any rusting or pitting. This also needs to be diluted. I believe this is a 1 to 6. Yes, it's a 1 to 6. Okay, there's a container for it over there. Change that weekly as well for your surgeries. That's also instrument loop there. All of our distilled water, it looks like a lot, but trust me, you guys go through it very, very quickly. Let us know when you're getting low so we can make sure to get more, okay? On the bottom, we do have sodium chloride. The reason we have it in these little containers versus the bags is if we're doing any kind of abdominal flushing, we need to open it and be able to pour it to the surgeon into the little buckets. All right, so this is a much easier method to keep it sterile and keep it ready to go. All right, this one, since it is open, it is no longer considered sterile. It's been open for longer than a month, so that can be thrown away. So that one can be eliminated. Okay. And then we also have our solution down here. Solution will be used for rinsing or flushing any wounds, things like that, but we don't use that nearly as common as